resistance. So rotation. So there's always going to be a rotary component to PNF. Okay? Also, when we're doing PNF, we have our vision, right? So we're always going to visually track. So if we're following right here, we're having Kevin visually track. Because the big thing with PNF is we're looking to restore that kinesthetic awareness. Okay, where this limb is in space. After an injury, you tell Kevin to put his arm up here above his head, it's just reestablishing where that limb, where that body part is, okay? So the visual tracking is really important. Second thing with PNF is our verbal cues. You guys familiar with that? So we're going to say pull, right? So if I was right here, I'm going to have him pull, 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 pull all the way through. If he's coming up, then I'm going to have him pushing. So our verbal commands can be pull or push. Okay? Also, we want to make sure we have manual contact with our patient. You guys are going to start off and you're going to be like this. Don't be afraid to slide close, slide up a little bit higher. There we go. And don't be afraid to have body contact because you're going to get close to your patient. Okay? So you have a manual contact. We want to allow smooth transition through the movement. With PNF, we always start distal. So we're going to go from distal to proximal. So now, what's this pattern right here? D2. There we go. So we have a D2 pattern. If we're going to do our D2 pattern, and we're going in, which way is this? So we're going into extension. Okay? So the first thing, if we're doing that pattern, we're going to go finger flexion, wrist flexion, internal rotation at the shoulder, adduction, extension. Okay? And what I'm doing right here is called rhythmic initiation. Are you guys familiar with that? So this rhythmic initiation is for the patient, and it's also for you. Especially if when you guys are younger and you're just starting off, it helps you remember, okay, this is where the pattern's going to be. Okay? As the clinician, athletic trainer, physical therapist, right, you want to make sure that you're in the diagonal. So the diagonal right here, I'm not doing this PNF over here because I wouldn't be in the diagonal. So I'm right here. So when I have Kevin pull all the way through, I'm right here in the diagonal. If he comes back up, I'm dropping back. So for you guys, you're going to have to make sure that you're moving your body, get your legs down. If you're a little bit shorter than I am, so on these tables, they work fine if you're 5'8" or taller. Anything under 5'8", you really need a high-low table that have proper mechanics because you're doing the movement. Otherwise, it puts too much stress on your back. Okay, so here, am I talking too fast?
They're used to me, so you're fine.
Okay, so I'm talking slow. Here we go. So the first thing, what we're going to do, we just did our rhythmic initiation. So go ahead and see your hand, Kevin. So right here, so look at me. I go ahead and I get my legs down. I'm going to have you finger flex, wrist flexion, internal rotation, adduction, extension. Go ahead and pull. And also, I like for my patients to have their knees bent. It's not a requirement. It's just easier on their back. Go ahead and bend your knees. There we go. Go ahead and pull. Slide over just a little bit. And so you can see each time I'm staying right in this pattern, right? And I'm going to go ahead and pull hard. Okay, go ahead and pull harder. Come on. Pull, pull, pull. There we go. Come on, pull. Kevin, are you kidding me? Are you a soccer player?
Yes.
Okay.
Gosh, Kevin.
I'll talk.
Okay, right here. So do you see that? I'm allowing a smooth transition. And the whole time, Kevin, it's not that when I'm, go ahead and pull it, Kevin's struggling, coming through. Slide down just a little. So this isn't a exercise just to show how strong you are. So make sure, and that's the biggest thing that I see with our students in the athletic training program. They'll start off and pull, and they're like, oh, because it's learning your resistance that you give to your patient. Okay? So once we end here, so what kind of contraction was I just doing? Slow reversal or repeated contraction? Okay, repeated contraction. So when we end here, this is the starting position. This right here is the starting position for our D2 shoulder flexion. So now we have finger extension, wrist extension, whether we're saying this is our supination, right? External rotation at the shoulder, abduction, shoulder flexion. Take them back down, finger extension, wrist extension, external rotation, abduction, flexion. One more time. So we're doing our rhythmic initiation. So you can see the one that I just went from on our extension, my hand's right here. He ends, I'm in the diagonal. This right here is called a lumbrical grip. So as he goes into wrist extension, finger extension, it locks in right in my hand. Okay? And I step straight back. This proximal, so our resistance starts distal. Go ahead and extend. Turn the hand over. And then I take it, 1 second. So I use the distal pressure until I get to about 90 degrees, and then it ends up going to proximal. So to this hand here. It's not this way. So you're going to turn your hand and his arm's going to fall right into your hand. Okay? Make a fist. Go ahead and extend the fingers, extend your wrist. Okay, go ahead and push. Push. Go ahead and push a little bit harder. Is your shoulder all right?
Yeah.
Just pops.
Yeah, all the time.
Okay, come on. Go ahead and push a little bit harder. There we go. But see how I'm dropping straight back? It's not, you guys are going to want to do this. Not, you might see it in some textbooks that show it that way. The thing that's going to happen if you do this often, you're going to end up hurting your back. So for me, I want to make sure if I'm teaching you guys that I show you a way that you're going to still be safe and you're not going to hurt yourself, okay? So, right here. Do you guys have questions on this? So that's still a repeated contraction. And here I'm going to show you what a slow reversal looks like, but they're not going to be responsible for doing slow reversals. Go ahead and relax. So, in order to do a slow reversal, you have to be very proficient and comfortable doing your repeated contractions, because now we have to switch hand placement. So in here I'm going to show you the way it looks, but you guys don't have to even practice it today, because I want you guys just to be comfortable in repeated contraction. So here we go, Kevin, go ahead and pull. So it's right here, now extend. Pull. So you can see that I'm switching hands, and it has to go fairly quick. Go ahead and push, 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 and pull. Come on, push, pull, push. And so here, if you're not comfortable with it, you're like, okay, where's my hand go, right? So let's just review this real quick. We're going distal to proximal, right? And our resistance starts distal. Right here, distal goes to proximal. Distal, is this making sense? If we're going into flexion, starts distal and then goes to proximal. So that is D2. No questions on D2. God, you're such a great teacher, Barbie. Okay, here we go.
Just quiet.
They're quiet.
So,
So after this, we'll have a quiz right here. So this is going to be D1, okay? So our D1, I'll have you put this down. So